Hi, I'm Dr. Robert Meyers, founder and director of New York Psychological Wellness, where we focus on patients suffering from chronic pain, insomnia, and emotional distress. I'd like to take a moment in this video to talk to you about the growing problem of chronic pain, insomnia, and emotional distress in our country today, and to tell you how we can help you with your patients. It is estimated that more than 100 million people in the U.S. suffer from chronic pain. Osteoarthritis is the #1 cause of pain and affects 60% of the pain population. 50% of those sufferers are over the age of 65. Approximately 70 to 90 million Americans suffer from insomnia, 30 million with depression, 40 million with anxiety. According to the CDC, almost 40% of the population, that's approximately 120 million people nationwide, suffer from serious psychological distress. In addition, a CDC release on January 1st, 2016 reports that the rate of deaths involving opioid overdose has increased more than 200% since the year 2000. Further, many patients abuse and misuse their medications, whether intentionally or unintentionally. And that leads to problems including addiction and psychosocial issues. The medical and psychological communities recognize that the successful treatment of chronic pain requires a multimodal approach, utilizing professionals from all areas of expertise. These approaches include pharmacopsychotherapy, interventional approaches, physical medicine and rehabilitation, complementary and alternative medicine, psychological support, and life changes. Pharmacopsychotherapy includes prescribing opioids, non-opioids, and other analgesics. Physical medicine and rehabilitation and interventional approaches may involve injections in joints or the spine, neurostimulation, electrotherapy, surgery, and more. Complementary and alternative medicine may involve acupuncture, chiropractic, and/or herbal and over-the-counter medicines. For this discussion, I would like to focus on the last third of the multimodal chart. Psychological support and life changes can play an important role in reducing the chronic pain experience, improve sleep, reduce the need for opioid pain relievers, and increase the quality of our patients' lives. My research and clinical experience suggests that chronic pain does not act alone on the individual sufferer. For many, the patients experience what I call the chronic pain triad: pain, sleep loss, and emotional distress in the form of depression, anxiety, fear, and/or anger help to exacerbate and perpetuate the pain experience. Now, these do not all have to appear in a patient's symptom profile. Any one or a combination of these three basic elements may be present. Alleviating or lessening these comorbid disorders will most likely lead to a reduction in the pain experience. And this can be done with a reduction in pain relievers or using none at all. Using a biopsychosocial theory of pain, it is posited that each has a unique effect upon the pain experience. When operating together, the effects are magnified, thus causing a greater pain response. The research conclusively shows that lack of restorative sleep increases the amount of chronic pain experienced. Therefore, treating the sleep issue will reduce the levels of pain encountered and help return the patient to a productive lifestyle. Cognitive behavior therapy, or CBT for insomnia, is a proven treatment with high efficacy rates. Most studies have indicated that CBT for insomnia is more effective than sleep-inducing medications and has a much longer-lasting effect after the treatment has been discontinued. Psychologically, the chronic pain experience leads to negative beliefs, emotional distress, and avoidance behaviors. These in turn work to increase the pain experience. The avoidance behaviors then create their own cycle in which the person engages in less activities which lead to deconditioning and a worsening physical condition, which promotes more isolation, negative beliefs, and emotional distress. Emotional distress, in the form of depression, anxiety, anger, and fear, activate the hypothalamus and the fight-flight response. The sympathetic nervous system stimulation activation is believed to increase the pain experience. The isolative behaviors, such as not engaging in social activities like family events, enjoying interactions with children and grandchildren, shopping, and the like, further add to the emotional distress and to the pain-maintaining cycles. Each of the elements that we have discussed that contribute to the pain experience occur in the brain. It is at this level that New York Psychological Wellness can help those suffering from chronic pain and insomnia. Utilizing psychotherapeutic treatments, we can improve the level of sleep, reduce negative thoughts and emotional distress, and help return the patient to a better quality of life. In addition to CBT for insomnia and psychotherapy, we utilize treatments such as biofeedback, relaxation training, encourage healthy eating and weight control, hypnotherapy, behavioral activation, and more. At New York Psychological Wellness, we'd like to help you help your patients who suffer from chronic pain disorder to live full, productive, and happier lives, with an eye towards reducing their need for pain medications. Please consider using New York Psychological Wellness in your chronic pain treatment plan. Thank you.